So as we see, my boy here is on snack number 2, and that's because he is growing so rapidly. So our boys, for whatever reason, seem to eat more than our girls, and they seem to be a bottomless pit, and you are a great demonstration of that right now. So in his little mouth right now, there are 2 little speed bumps right in his lower gums. And that is the sign that there are the first 2 primary incisors that are emerging. Now, teething is a process. It's not an illness, and I can't emphasize that enough because too many parents worry that their kids are going to have high fevers, or they interpret fevers as teething when in fact something else is going on with them. So for most children, those first 2 teeth may erupt with a little sleep disruption or a lot of hand-to-mouth behavior or a little bit of fussiness, but that's usually alleviated by taking an ice cube and wrapping a little washcloth around it and rubbing it on his gums, or even just taking your fingers and just massaging the gums there. That's typically enough, exactly. Or a cold pacifier. I mean, if you have any pacifiers, throw them in the freezer and then give them to them, and something cold like that generally will
that's our secret weapon for teething.
Perfect. But teething, once a child gets used to that sensation, once the teeth have broken through, it's not a big deal. It really isn't. So we don't have to make a big production about teething. And if there is pain that seems to be above the norm, certainly oral pain relievers are apropos, especially at bedtime. During the day, kids are very distracted with their surroundings, but at nighttime they may struggle a little bit. So it's something to talk to your healthcare provider about. What else can we say about your face? Well, I'm seeing a wonderful little vein here, and babies who have very translucent skin, like Luca, often will have very visible veins on their forehead, on the bridges of their noses, and that's because their skin is still very thin and very translucent. And as his skin toughens up and thickens over time, you're going to see those veins be less and less obvious, although every once in a while there's a child who has one that still sort of persists, so not to worry. And since we're on skin, let's talk a little bit about how skin evolves. We've already been through the peeling and shedding stage of the first 3 to 4 weeks, and all the typical infant skin manifestations like cradle cap and seborrhea behind the ears and milia, which are the little white dots on the nose, have come and gone by now. But what happens with babies over this next 2 years? Well, first of all, genetically, certain things begin to express themselves. So if we've got 2 parents with a lot of freckles, guess what? No matter whether you keep your baby inside or have them out in the sun, some freckles are likely to appear. Same thing with moles. If you're moly, or if his dad is moly, then you may see a mole or 2 erupt. And it doesn't mean that you've done anything wrong. It's just that genetics are starting to express themselves.
So since I'm pretty freckly, and so is my husband.
Yeah, so you may not be able to prevent it. I mean, you want to put sunscreen on and keep a lot of solar damage from his skin, but nature has its own mind. And so you will probably see some freckles emerge over time, and they're absolutely a sprinkling of joy, and one of those things that, again, welcome us into his face. So we don't mind those things happening. He has some pale pink birthmarks on the nape of his neck. We call it a stork bite, or on his head, and we call that a capillary hemangioma, or just a strawberry mark. And those typically tend to fade, or they'll just hide under hair over time. But because they're not visible on his face or any place, they're just covered with hair right now, we don't really worry about them. But the good news is if your child does have any hemangiomas or birthmarks that are on the face that are typically going to cause maybe a little distress initially, typically the ones that are flat or pale pink are going to go away 100% of the time, and only in rare circumstances where kids have genetic birthmarks that are deep purple or deep red, those are ones that typically will require some medical knowledge, some medical education, and sometimes some medical intervention. But for you, the outlook is good. The other thing, thank you very much for that. The other thing too is that even though children wear sunscreen at this age, they still can get farmer tans, and we know what those are. That's exposed arms, exposed legs, that no matter how much SPF you put on them, there can be some solar pigment changes. Okay. So one of the things that we recommend for all babies, and especially babies under 6 months of age, is when you're outside in the sun, try to put loose, comfortable, cool clothing on baby and cover as much surface area as possible. But for the little feet, the little hands, and the head that stays out in the sun, if he refuses to wear a hat, or you can't avoid the sun and I know you're going on vacation soon, then it's very important to know that it's okay to put sunscreen on babies under the age of 6 months, preferably mineral sunscreen with titanium or zinc, because those tend to be gentler ingredients and aren't as irritating to the skin, and they have marvelous UVA and UVB protection ability. So that's your sunscreen primer for today. Now let's see if we can talk about your neck before you need another snack here, mister. So most babies have this disproportionate look. They kind of look like Ewoks from Star Wars. They're just head on shoulders and not much neck in between. And as they grow and develop, we notice that even Luca has a nice little neck right now. He can turn his head, he's looking around. He uses it to support this upright position because he's taking in the world developmentally right now. And as he gets older, his cervical spine, or we call it the C-spine, each and every vertebrae there is going to lengthen, and he's going to kind of move up like a little mini giraffe so that he can get even a bigger view of the world. So this area is a little challenging in these early childhood years, because if your child is head on neck and doesn't have a big space between there, rashes happen there very frequently. So it's an important thing to do after bath time to really survey that area and see if there's any breast milk or formula or just sweat or old skin that's starting to smell like cheese in there. It's just important to honor that and keep it clean so he's not uncomfortable. But his neck is so important because these muscles now, he's building, he's looking up at everything now so that he can hold his head upright, so that he can hold it in this position to crawl and be able to navigate his world, and then ultimately to stand up and hold himself together. And the neck has to be strong because this noggin of his is still proportionately going to be big in relationship to the rest of his body till he's almost 3. Oh, okay. So when kids start moving and they sort of lead with their heads, that neck has got to be strong to hold them up. And so he will likely, you will see, be craning his neck left and right. When he's on his tummy, his head will be up, and when he's sitting up in your lap, he's going to be moving side to side, and all that is his little aerobics necessary to have that neck support you so that you can see and experience the world in the best possible way, right? Especially seeing me, yes.